Further debate, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. Speaker, it's long past time that we return to a functional parliament and a representative democracy. Sadly, instead, we have only a partial return. The Premier continues to act with unaccountable power under this state of emergency and is limiting the legislature's ability to raise matters on behalf of our constituents. And last week, we learned that the Premier has delegated all decision-making authority to Dr. David Williams. As the Premier stated, and I quote, "Cabinet debates and discusses issues, but Dr. Williams makes the decisions." Speaker, the Premier's comments are evidence that we are in a state of dysfunction. Speaker, last Friday, while the Premier was making a video showing people how to make a cheesecake, I was on the phone speaking with a young lady from my riding. Her name is Kate, and up until very recently, she had 4 loved ones living at Almont Country Haven. Earlier, and within days of one another, 3 of her loved ones died at Almont Country Haven from COVID. She hopes and prays for the remaining loved one. We spoke at length. She shared with me her concerns and her stories, and I shared what information and advice that I could give. This motion by the NDP calls for a public inquiry into the tragedy in the LTC. A public inquiry is essential, and I support this motion. However, I do want to raise some additional concerns for all members to consider and include them in the terms of reference. And that is, what role did public health play in this tragedy at LTC? I'm of the view, indeed I believe the evidence is compelling, that public health failed and that their actions and decisions may have amplified this tragedy. As we know, the Premier stated that Dr. David Williams is making all the decisions. I guess that would include the decision to reject the OMA's offer to send family physicians to create assessment centres at LTC homes, and the decision not to utilize our 500 private labs throughout Ontario to expand our testing capacity, as well as the decision to close private practices and clinics and only to allow telephone consults, or the decision to remove 1,000 hospital patients out of their hospital beds and into long-term care. How about this other decision to allow cross-contamination of multiple LTC homes and to enforce infected employees back to work after being symptom-free for only 24 hours? And the decision to only provide PPE to our hospitals and to leave LTC unprepared. Of course, there was also the decision to prevent residents from temporarily leaving LTC, and the decision that LTC residents were not to be admitted to hospitals. Speaker, public health forgot that our healthcare system is often delivered by the private sector. The self-employed physicians, private sector nurses, home care, PSWs, private labs and clinics. Dr. David Williams and the Premier have had tunnel vision. They chose to believe that our healthcare system consisted only of hospitals. Do we need a public inquiry? You're damn right we do. And I hope Katie and I are called as witnesses. Speaker, to close, public health acted in a manner that could only lead to one end, and it did. an overloaded, understaffed, underprepared, under-resourced LTC sector, and our elderly have paid the price. And while public health may have made these decisions, let us not forget, not for 1 minute, it is the Premier and his ministers who abdicated their responsibilities. A public inquiry is essential, not the smoke and mirrors and the fix of an independent commission. Thank you.